I'm Dr. Christopher Trahan. I'm the founder and the medical director of the Olympus Center for Holistic Integrative Medicine in New York City. We practice effective natural therapies in a context of cutting-edge Western medicine. We provide therapies such as acupuncture, Asian and Western herbal medicine, classical homeopathy, nutrition, various kinds of body work and physiotherapies, and medical and psychological counseling, very much oriented in patient education. So my typical patient is coming to me for acupuncture for a specific medical issue, and they may not realize it, but they're also going to be treated with herbal medicine, which incorporates healing aspects somewhere between drugs and nutritional aspects. Today, I'd like to speak specifically about acupuncture for a few moments. First of all, I don't know if there are many people that doubt this, but in the old days, going back some, if I may say so, 40 years, one of the popular bumper stickers was acupuncture works, because at a certain point in time, and according to some MDs today, excuse me, if you can believe it, they didn't know that acupuncture works. It's a very strong physiological therapy. It's not placebo, it's not psychological. In the old days in Life magazine, as I recall as a boy, in the 60s, they had a thing about acupuncture, and they thought it was some sort of hypnotism or shamanism. But it's very much a physiological therapy. It affects the nervous system, affects the brain chemistry, affects all of our organs. It strengthens the immune system, and it strengthens the adrenal glands. In these days of COVID, the immune system and our stress resilience are even more prominent than ever. I got into acupuncture partly because I had studied Eastern philosophy and I had allergies, and I didn't want to get allergy shots. And several months, twice a year, I was having sneezing and runny nose and whatnot. And I had begun to study things along the lines of natural medicine. And I was at an herbal medicine seminar, a month-long training right after I got out of college. And somebody was having allergies, and there was an acupuncturist there. And I wasn't particularly eager to try acupuncture, but I said, okay. And I got an acupuncture treatment, and it helped my allergies at that point, symptomatically, for a finite period of time. I ended up moving to California, into the Bay Area. I was beginning, again, soon after college, to kind of pursue my interests. I didn't want to go to medical school. I didn't want to be a chiropractor. I didn't want to be a physical therapist. This was the very beginnings of the profession. And the Bay Area in San Francisco, California, was the mecca of Chinese medicine at that point in time. Now it's all across the country as well as the world. So with acupuncture, it's not just like replacing pain medication like analgesics. Acupuncture does treat pain. I don't have patients coming to me that I'm just trying to block their pain. I'm trying to resolve and ameliorate the cause of their pain, which could be structural, could be neurological, whatnot. On the other hand, especially in conjunction with herbal medicine, nutrition, I do a lot of what we would call internal medicine. Most of the illnesses and diseases that we have come under the rubric of internal medicine, right? Your organs are not quite working right, your immune system, your nervous system, your stress response and whatnot. Stress reduction. By now, we all talk about stress and illness, but back in the 60s, for instance, medical doctors were not talking about any kind of stress response or stress effect. Again, acupuncture stimulates the pituitary gland to produce these peptides called endorphins, which are 5,000 times more powerful than morphine. So when people get acupuncture, they tend to not only get their symptoms better and their diseases get better, but they actually become happier after one treatment, or also cumulatively. They just feel better. They have a much better sense of well-being in their life. I'll be back someday soon to speak some more about my practice. Thank you.